going to begin now, and when the seventh person comes, we'll be in a position to vote. So the Senate Committee on Health, Education, Labor, and Pensions is coming to order. Today, we will be holding a vote to authorize an investigation into the bankruptcy of Steward Healthcare and to subpoena its CEO. And let me begin by thanking Ranking Member Cassidy for his cooperation on this important issue. And let me thank Senator Markey of Massachusetts for his outstanding leadership on this matter, for holding the first hearing on the subject in the subcommittee that he chairs, and for bringing this issue to our attention. Ed, thanks very much. In my view, and I think the view of most Americans, we have a healthcare system today that is broken, it is dysfunctional, it is wildly expensive, and in many cases, it is extremely cruel. It is a system that is designed not to make patients well, but to make insurance companies and drug companies and other people who make money off of the system extremely wealthy. And in my view, there could not be a clearer example of that than private equity executives on Wall Street making huge amounts of money by taking over hospitals throughout our country, loading them up with debt, and stripping their assets. Perhaps more than anyone else in America, a dubious distinction, no doubt, Ralph De La Torre, the CEO of Steward Healthcare, epitomizes the type of outrageous corporate greed that is permeating throughout our for-profit healthcare system. Working with private equity executives, Dr. De La Torre became obscenely wealthy by loading up hospitals from Massachusetts to Arizona with billions of dollars in debt and selling the land underneath these hospitals to real estate executives who charge unsustainably high rent. As a result of Dr. De La Torre's elaborate Ponzi scheme, Steward Healthcare and the more than 30 hospitals it owns in 8 states were forced to declare bankruptcy with some $9 billion in debt. And let us be clear, while Steward Healthcare declared bankruptcy just a few months ago, its severe financial problems have been going on for more than a decade. And here are just a few examples. In 2014, Steward shut down the Quincy Medical Center in Massachusetts, laying off 700 healthcare workers with the exception of its emergency room, which it shut down 6 years later. In 2018, Steward shut down the Northside Regional Medical Center in Youngstown, Ohio, laying off 468 healthcare workers and closing the only labor and delivery unit in that city for pregnant women and their babies. In 2019, Steward shut down St. Luke's Medical Center in Phoenix, Arizona, laying off 655 healthcare workers. Last year, Steward shut down the Texas Vista Medical Center in San Antonio, laying off 827 healthcare workers. This year, Steward shut down the New England Sinai Hospital in Massachusetts and a medical center in Southeast Texas. It also temporarily shut down Norwood Hospital in Massachusetts, but then stopped paying the construction workers who are working on the project, making it unlikely that this hospital will ever reopen. Steward has shut down several pediatric wards in Massachusetts and Texas, and closed neonatal units and eliminated maternity services at a hospital in Florida. Its medical center in Louisiana is at risk of closure after being cited on multiple occasions for putting patients in immediate jeopardy from regulators. It has failed to reopen hospitals in Utah, Texas, and Florida, even though Steward received hundreds of millions of dollars from private equity and real estate firms to serve patients in those states. And on it goes. We know that Steward has gone bankrupt. We know that several of its hospitals have already been forced to close their doors because they ran out of money. We know that communities and the people in those communities that depended on these hospitals are uncertain about what this bankruptcy means for their future. It is a big deal when a hospital in your community shuts down. But here is what is particularly obscene about this whole complicated situation. In the midst of all of the crises that Stewart's policies have had on hospitals and communities all over this country, Dr. Delatorre has been doing phenomenally well financially. Hospitals shut down, workers laid off, patients suffer. Dr. Delatorre has been doing extraordinarily well financially. The hospitals he managed closed down, and he makes huge sums of money. While Stewart was busy shutting down hospitals all over America, Dr. Delatorre received a $100 million payday that he used to purchase a $40 million yacht. There is Dr. Delatorre's lovely yacht. While Stewart's hospitals were laying off healthcare workers, Dr. Delatorre received some $16 million a year in compensation, enough to afford this $15 million custom-made luxury fishing boat. Not quite sure how you pay $15 million for a fishing boat, but while they were shutting down hospitals, that's what he managed to do. Now, while Stewart-owned hospitals could not afford to pay for life-saving supplies, it had enough money to purchase a $62 million private jet. Hospitals shut down, workers laid off, patients without care, private jet. But apparently, for Ms. Dr. Delatorre, one private jet is not quite enough. So what did his company do? Because how can you get by in this day and age with one private jet? You know, it's tough. So what his company did is bought a backup jet worth an estimated $33 million just in case the first jet broke down. It's kind of normal medical procedure. And it is almost hard to make this stuff up. The greed that we are seeing here is really quite extraordinary. Now, how many of Stewart's hospitals could have been prevented from shutting down? How many lives could have been saved? How many healthcare workers would still have their jobs if Dr. Delatorre spent $150 million on high-quality healthcare instead of his yacht, 2 private jets, and a luxury fishing boat? We are here this morning because time and time again, this is an important point to make, time and time again, Senator Cassidy, Senator Markey, and I have invited Dr. Delatorre to come before Congress, to come before this committee, to testify about the financial mismanagement at Stewart. And time again, he has arrogantly refused. Well, today we are saying enough is enough. It is time for Dr. Delatorre to get off of his yacht and to explain to Congress the financial chicanery which made him extremely wealthy while the hospitals he managed went bankrupt. It is time for Congress to hold Dr. Delatorre accountable for his extreme greed. And let us also be clear, this is not just about Dr. Delatorre. Cerebus, the private equity firm he partnered with, made an $800 million profit from its investments in Stewart Healthcare. Where did that money go? Other than Dr. Delatorre, who else benefited financially from these financial schemes? Those are just some of the questions we will be asking. Further, this is not just about Stewart Healthcare. In America today, rather alarmingly, private equity firms own 460 hospitals, 22% of all for-profit hospitals in our country. How many of these hospitals are being loaded up with debt in order to make a handful of executives at private equity firms even wealthier? How many of these hospitals are in danger of being shut down? How many patients are at risk because these hospitals may no longer afford to purchase life-saving medical equipment? These are questions that the American people deserve to know, and these are questions that we must be asking. Senator Cassidy, you are recognized for an opening statement.
Thank you, Chair Sanders. Today we're voting to subpoena the testimony of Steward Healthcare's Chief Executive Officer, Dr. Ralph De La Torre. The Health Committee has never issued a subpoena to compel testimony. There's a reason for doing so now. Subpoenas should only be used when absolutely necessary, when all other efforts have failed. And the subpoena we are voting on today meets that criteria. In 2010, private equity firm Cerberus Capital Management purchased a group of failing hospitals in Massachusetts, saving them from bankruptcy and preserving access to care for the communities they served. They formed Steward in a joint venture with Dr. De La Torre and his executive management team to manage the hospitals, which became the largest private for-profit hospital operator in the United States. And the hospitals were successful, due in part to Cerberus's investing hundreds of millions of dollars in facilities and resources. Cerberus also assumed hundreds of millions of dollars in pension liabilities. However, Dr. De La Torre remained responsible for the management of Steward and its day-to-day operations. From 2015 on, Steward, under Dr. De La Torre's leadership, began to expand at an unsustainable rate. In 2016, Dr. De La Torre made the questionable financial decision to sell Steward's real estate holdings to Medical Property Trust, or MPT, and have Steward hospitals lease them back. That deal allegedly earned Dr. De La Torre and his executive team a very large payday. From there, his bad management decisions continued. In 2018, Steward entered into a public-private partnership with the country of Malta to run a number of hospitals in Malta. The deal is now under investigation by the Department of Justice over allegations of fraud and corruption. In the wake of COVID-19, there were disagreements regarding Steward management. Cerberus sold its controlling ownership stake in the company in June 2020 to a group of physicians, again led by Dr. De La Torre. To secure the funds to purchase Cerberus' controlling interest, Dr. De La Torre secured a loan from MPT. The buyout allegedly earned him a $100 million dividend. While Dr. De La Torre was paying himself millions, Steward fell behind in its mortgage payments, owing approximately $50 million in January 2024, or 1/2 of the dividend Dr. De La Torre received. In May, Steward filed for bankruptcy, publicly declaring debts of approximately $9 billion. Now, we must learn about these financial deals because it spelled the beginning of the end for Steward and its more than 30 hospitals across the country, including in my home state of Louisiana in West Monroe. Stepping back, it's important to recognize that Steward is not a private equity firm. Private equity did not cause the situation we're seeing today. In fact, robust private equity investment kept the hospitals afloat in 2010. Now, I practiced medicine for 25 years, and so you have the mindset. If you're going to make the right decision for a solution, the right prescription, if you will, you have to have the correct diagnosis. Blaming private equity for Steward's mismanagement is not productive. It ignores that private equity invested hundreds of millions of dollars into failing hospitals, made them successful, and then sold them to a private management team, which was not private equity. So to make the correct diagnosis is important if we're going to come up with the correct prescription. Steward's financial troubles have seriously impacted its hospitals, threatening patients' access to life-saving care. Hospitals have had essential medical supplies repossessed by banks to pay off Steward's debts. Workers at its facilities have been laid off, leading to a reduction in outpatient services and an increased burden on the remaining staff. The facility in West Monroe is Glenwood Regional Medical Center. According to the reports from the Centers for Medicare and Medicaid Services, a physician at Glenwood in West Monroe told a Louisiana state inspector that the hospital was performing, quote, third world medicine. Because of management decisions resulting in limited resources at Glenwood, the state had to force the hospital to operate at 1/3 its capacity. One patient died waiting for a transfer to another hospital because Glenwood did not have the resources to treat. Inevitably, nearby hospitals, in fact, hospitals across the state, absorbed that burden, straining those facilities' ability to deliver quality care. Addressing this must be a top priority. Reportedly this week, someone may purchase Glenwood, While this needs to be approved by a bankruptcy judge, it's a good sign. Now we need answers as to how Glenwood got to this point. Unfortunately, Glenwood is not unique. At a Stewart-owned Massachusetts hospital, a woman died after giving birth when doctors realized mid-surgery that the supplies needed to treat her had been repossessed due to Stewart's financial troubles. And these examples are across Stewart's hospitals. Dr. De La Torre and his executive team's poor financial decisions and gross mismanagement is shocking. Patients' lives are at risk. Americans deserve answers. On June 25th, Chair Sanders and I asked Stewart CEO Dr. De La Torre to testify before the committee. He refused without further discussion and did not counter with another date. He did not offer another company official to appear. Let me be clear, the committee would have been open to working with Stewart to ensure cooperation. They ended the negotiation before it started. The decision to subpoena Stewart does not come lightly, but the situation is actively impacting patients in the communities we represent. Congress has a responsibility to act. Patients should not be turned away or denied care because of Dr. De La Torre's irresponsible business practices. My goal is to ensure that residents in the community served by Stewart hospitals, such as West Monroe, served by Glenwood, receive the care they get, and to get to the bottom of these problems to make sure they do not happen again. That is our top priority. I thank Chair Sanders for his collaboration in our bipartisan investigation. I urge colleagues to support this subpoena.
Senator Cassidy, thank you very much. I wanted Ed Markey to say a few words because Senator Markey has been active in this. Ed, I want to do a vote soon, but if you wanted to say a few words.
No, thank you. Thank you, Mr. Chairman, very much. And first of all, thank you for allowing me to have a hearing in Boston on April 3rd on this issue, which illuminated the breadth of the absolutely irresponsible conduct that Ralph De La Torre and Stewart Health have been engaging in. I want to thank you and Senator Cassidy for your leadership on this issue. And I'll just briefly make the point that on March 10th of 2010, Dr. Ralph De La Torre celebrated the creation of Stewart Healthcare, the purchase of several nonprofit hospitals in Massachusetts with a commitment to offer world-class medical care. Unfortunately, Dr. De La Torre invited private equity and real estate entities into the halls of our healthcare system, and a disaster began. Under Dr. De La Torre's leadership, health providers and hospital administrators watched emergency room lines grow, forced to face patients knowing that they did not have the resources nor the staff needed to provide the world-class care that Stewart and Dr. De La Torre had promised, as he had purchased the nonprofit Catholic system in our state and turned it into a for-profit system, and he promised even better care. Stewart let the physical and financial infrastructure of those hospitals in Massachusetts and Louisiana, Pennsylvania, Arizona, Arkansas, Florida, Ohio, and Texas wither. And while all of that was going on, as you have pointed out, he was purchasing yachts, private jets, personally enriching himself and his other colleagues as this hospital system was left in disarray. And not satisfied with going from just the 6 Catholic hospitals in Massachusetts, which are now in a state of collapse, he then expanded across the country to 30 hospitals in our country, and then went international to Malta to take over their system as well, where he is now being investigated for the very same irresponsible conduct that our committee is investigating here in the United States. So this is a story of private equity with no constraints, taking over a massive hospital system, and then looting it for their own personal wealth, allowing for the health care of the patients to wither while simultaneously enriching the individuals at the top. So I thank you, Mr. Chairman, and Ranking Member Cassidy for this leadership, because I think this hearing that we are going to have here before us is going to be an historic one. It's going to put the focus on the role private equity is playing in this hospital sector. This is not taking over a widget company. It's not taking over a coffee company. This is where they take over hospitals, and they apply the very same standards to those hospitals which they would apply to a widget company. So all I can say to Dr. DiLatorre is you cannot treat communities as expendable. You are accountable. Your day of reckoning is going to arrive here on September 12th in the Health Committee.
Thank you very much, Senator Markey, and thanks for your work. Okay, we're going to have 2 votes. I note the presence of a quorum, and we will now move to votes. I move that pursuant to its authority under Rules 25 and 26 of the Standing Rules of the Senate and Rule 17 of the Rules of Procedure of the United States Senate Committee on Health, Education, Labor, and Pensions, the Senate Committee on Health, Education, Labor, and Pensions hereby authorizes an investigation into the bankruptcy of Stewart Healthcare, including authorizing the committee to hold hearings for the purpose of taking sworn testimony and testimony by subpoenaed witnesses in this investigation. The clerk will call the roll.
Senator Murray.
Aye by proxy.
Senator Casey. Aye. Senator Baldwin.
Aye by proxy.
Senator Murphy.
Aye by, oh, there we are. All right. Aye in person there.
Senator Kane. Senator Hassan. Senator Smith. Senator Lujan. Senator Hickenlooper. Senator Markey. Senator Cassidy. Senator Paul.
No by proxy.
Senator Collins.
Aye by proxy.
Senator Murkowski.
Aye by proxy.
Senator Braun.
Aye by proxy.
Senator Marshall.
Aye.
Senator Romney.
Aye by proxy.
Senator Tuberville.
Aye by proxy.
Senator Mullen.
Aye by proxy.
Senator Budd.
Aye by proxy.
Chairman Sanders.
Aye.
I have 20 ayes, 1 nay.
The ayes have it. The motion is agreed to pursuant to its authority under Rules 25 and 26 of the Standing Rules of the Senate, Rule 17 of the Rules of Procedure of the United States Senate Committee on Health, Education, Labor, and Pensions. The Senate Committee on Health, Education, Labor, and Pensions hereby authorizes its chair to issue a subpoena to Dr. Ralph DiLatorre, Chairman and Chief Executive Officer of Stewart Healthcare Systems, to give testimony at a hearing of the committee on September 12th, 2024 at 10 a.m. in 562 Dirksen Senate Office Building or at such other time and place that may be designated regarding the bankruptcy of Stewart Healthcare. The clerk will call the roll.
Senator Murray.
Aye by proxy.
Senator Casey. Aye. Senator Baldwin.
Aye by proxy.
Senator Murphy. Aye. Senator Kane. Aye. Senator Hassan. Aye. Senator Smith. Aye. Senator Lujan. Yes. Senator Hickenlooper. Senator Markey. Aye. Senator Cassidy.
Aye.
Senator Paul.
No by proxy.
Senator Collins.
Aye by proxy.
Senator Murkowski.
Not voting.
Senator Braun.
Aye by proxy.
Senator Marshall.
Aye.
Senator Romney.
Aye by proxy.
Senator Tuberville.
No by proxy.
Senator Mullen.
No by proxy.
Senator Budd.
No by proxy.
Chairman Sanders.
Aye.
I have 16 ayes, 4 nays.
The ayes have it. The motion is agreed to. That concludes.
Mr. Chair,
Yes.
Kane here, 30 seconds.
Yep.
You posed a rhetorical question. How could anyone even spend that much on a fishing boat? Could you bring the fishing boat picture back up? You didn't ask for an answer, but I have an answer for you. The builder of this boat declared that it was, quote, the most ambitious custom sport fish boat ever built, close quote. That is how you spend $15 million on a fishing boat.
All right, now we've learned something. Okay. Our votes are concluded, but if anybody wants to speak briefly on the matter, the floor is open. Any thoughts? All right. Seeing no one else, let me again thank the ranking member for his cooperation. I think what we're doing is significant, and thank all of the members for being here. The committee stands adjourned.